Yes, there are a number of hotels across the country, you just talked about a few of them, that are actually offering free or deeply discounted rates to healthcare providers and first responders. And that's critically important because we need to make sure that people that are sick are getting care, and so we want to do our part. The second part of this program also includes hotels being used as overflow for hospitals that may be full or for quarantine centers. We just had the state of California a couple of days ago announce the usage of 11,000 or 15,000 hotel rooms statewide to help put people in that need to be quarantined and separated from the rest of society for a brief period of time. And hotels are helping out in that way as well.
So then in terms of occupancy, how is this playing out in terms of the most popular locations or hotel brands that are really taking advantage of this?
Well, I mean, look, most of these rooms, again, are being given away or it's done at a deep discount. So this is really having no impact on most hotels' ability to stay in business. A few, it will help a little bit, but keep in mind there are 56,000 hotels across the U.S. About half of those are functionally closed right now. They're either fully closed or they're just running maybe a single-digit occupancy with a couple of employees. So for those hotels, the only way you get past this is for people to start traveling again. But during the interim, if we can help, if our industry can help others, that's exactly what we'd like to do.
And we know that we've seen, as we mentioned in our report, there's some hotels making adjustments in terms of perhaps waiting 3 days to allow people to come in and clean. And we know these adjustments require keeping some staff on duty. So talk a little bit about the sort of precautions that are being taken to ensure the workers' safety.
Well, one thing with respect to the workers, about 75% of the entire industry is not working right now. So they're at home and hopefully sheltering in place since that impacts about 95% of the country. For those that are working, there are very few guests, so the hotels are taking extraordinary steps to make sure, at least right now, that there's not a lot of contact between the guests and between the workers. But really what we need is for the economy to get rolling again, people to start traveling again, and put in place those safety precautions that we know are coming that can help keep people safe and this industry growing again, because the last thing we want are almost 8.5 million people out of work.
And as you mentioned, some of these big hotel names, behind each one of them is a small business owner. So talk a bit about some of the biggest concerns that you're hearing from members of the AHLA regarding what they're seeing with COVID-19.
Yeah, that's a great point. Unlike the airline industry and probably the cruise industry, where you see these big names and there's just a few major large corporations running those industries, in the hotel industry, the big name you see at the top of the hotel is almost always not the owner of that hotel. It's a franchise business. In fact, the Small Business Administration characterizes well over 60% of hotels in the U.S. as small businesses. So they are local business owners. They are franchisees that may own one hotel or two hotels, and they usually only have a month or 2 months worth of reserves to be able to keep that property afloat. So right now, where there's almost no revenue, they're doing everything in their power just to keep the business open.
So then, as we also now look at the government relief measures for the hotel industry, what's good so far, and what more would you like to see done?
Well, what they've done so far, we're very appreciative of. I think it's important that people keep in mind that the bill that passed and now is part of law, the CARES Act, was the single largest spending item ever passed by any, to our knowledge, any government anywhere in human history. And they did that in the course of a couple of weeks, so we're appreciative of that. But when you attempt to do something that large, you also recognize that you'll need to go back and look at it and see if there are changes. Many of the changes that we believe need to be made to the law really deal with the dates that they put into the law. So when they were considering this problem wasn't fully known. And as you know, every day that goes by, we learn more and more about it. We learn more about the impact. We also learn how much longer we can probably expect this to go on. So we think they need to come in and look at some of the dates. It had assumed we'd be back in business by June 30th. The hotel industry is not going to be back in business at full strength, probably for a good couple of years.
So just very quickly, we have about 15 seconds. If you could sum up your outlook for the industry if this pandemic does continue past summer and fall.
Well, this will be the worst year in the history of the hotel industry in the United States. There's no question about that, and nothing else is even close. Next year, we hope to gain back about half of what we lost, and then by 2022, we believe we'll be back up to full strength. But it is a long time between now and 2022.